Hello everyone, I'm back on here doing another video to discuss pre-transplant. From the other video that I did talking about my pregnancy, I was discussing why I had to get a LVAD. Now, this particular video is talking about pre-transplant. I took on a decision to get a heart transplant, which I didn't have to get one. I could have just kept the LVAD, but keeping the LVAD did not give me the quality of life that I wanted. I wanted to be able to run with my son, be able to go to the swimming pool, get on roller coasters, be able to take a bath. And I also wanted to just feel normal again and get back to work delivering mail as a letter carrier. And so with having the LVAD, I wouldn't have been able to do that. So for me, the LVAD was a bridge to getting a heart transplant. So it was always in the talks with my healthcare providers with me getting a heart transplant. So I made that decision in October of 2015. So I was placed on the heart transplant list October 2015. And I got my heart transplant April the 2nd of 2016. So I was only on the list for 6 months, which is really quick. My situation was stable, but at the same time, because I chose to do the bridge to from an LVAD to a heart transplant, the severity of the situation with my heart was a must, you know. So the things that qualify you for a heart transplant, first and foremost, your doctors have to agree with the fact that your heart is just not going to recover. So it's just not going to get better. So that was a decision based off just everything that I went through and having congestive heart failure. So the best decision was for me to get a heart transplant. So they do blood work. It's based off your size. They also test your psychological situation. They want to make sure that you are able to take on the responsibility of getting a heart transplant. It's not just, boom, you get a heart transplant. They want to know that you're going to take care of this new donor heart that you are receiving, because first and foremost, it is a blessing. Sadly, that someone else have to pass away in order for you to be given the opportunity to have a second chance at life. But it's a blessing, and they want to know that you are mature enough, responsible enough to make sure that you are going to take your medications on time, that you will not skip taking a medication, because the medications that you take are vital. You know, when you get a heart transplant, your body, your immune system will attack the new donor heart because it's recognized as a foreign object. And so whatever heart that you get, your immune system is going to attack it. So you have to take these medications. And I'm going to go into that a little bit later to make sure that your body, your immune system, don't look at the donor heart as a foreign object that shouldn't be there. So, and they want to make sure that you don't abuse drugs, you don't drink alcohol, and also the reason for getting, I needed it because I had congestive heart failure, like I said, and also my heart muscle was enlarged thick, and that is called cardiomyopathy, and so that's another reason why I needed a heart transplant. So I'm quite sure everybody knows what a heart transplant is. But if you do not know, I'm going to give you a little bit of educational information about that. So, and I'm going to put the website that you can go on as well if you want to look up any more information or read more about heart transplants. So I'm getting this off of the website at johnhopkinsmedicine.org. So this is information about what a heart transplant is. So I'm quoting the article on johnhopkinsmedicine.org. It says a heart transplant is surgery to remove the diseased heart from a person and replace it with a healthy one from an organ donor. To remove the heart from the donor, 2 or more healthcare providers must declare the donor brain dead, unfortunately. Before you can be put on a waiting list for a heart transplant, a healthcare provider makes the decision that this is the best treatment choice for your heart failure. A healthcare team also makes sure you are otherwise healthy enough to go through the transplant process. So, like I was saying, it's more than just the fact like, okay, this person's heart has given out because of this particular reason, and okay, they can just get a heart transplant. No, you have to be healthy enough physically, mentally you have to be evaluated to make sure that you are responsible, you know the severity of the situation, you are going to take care the precious heart that was given to you in order for you to be able to live. Your size also comes into the equation. Your blood type as well comes into the equation of being evaluated for a heart transplant. Okay. And also, diagnostic tests. So they will do, and I went through all this. They had to do x-rays, the ultrasound, CT scan. I had to get my lungs checked, pulmonary function test to make sure my lungs are good. Dental exam. So this is another important aspect of it too. People would think like, okay, what do your teeth or dental have to do with getting a heart transplant? It has a lot to do with it, because if you have any cavities, any gum disease, anything that's going on with your mouth that can cause an infection, because it could go straight to your heart. Now, if you have an infection in your mouth and it reaches your new heart, that means, okay, you just basically, you can die. And also that heart is no longer useful. So you could die from the bacterial infection that came from your mouth, or you would have to get a new heart transplant, and you would need a new donor. And it was this heart that was perfect for you that was basically unusable because you had an infection. So you also have to make sure that your dental exams come back good. You have no cavities, no type of stuff going on with your gums or anything like that. So that's another thing. And also a pap smear for the women. You have to get that to make sure there's no cancerous cells, no cancer, nothing going on, because that would be another issue right there. And they all say a mammogram, but I wasn't old enough to get a mammogram, so that didn't play a part for me. And also you have to get vaccinated. I got my flu shot. I got my pneumonia shot. Tuberculosis shot. I got that too. Vaccination. Okay. And also, another important aspect, they want to know that you're going to have support after you get a heart transplant. Now, if they, because you're going to need people to help you, people to take you to your doctor's appointments, um, you're going to need help. So, dealing with the psychological and social evaluation, they want to make sure that it don't include like stress, like you don't have any stress bearing on you, financial issues, that you don't have financial issues, um support from family or significant others. These are factors can greatly affect how you do after the transplant, so they definitely evaluate the psychological and social aspect of your life. And so once these come back as being good results for being a candidate for a heart transplant, the next thing they do is put you on a transplant list. And I just thank God that everything came back perfect to where I was put on a transplant list, because they don't give you an answer right away. Of course, they call you and let you know, like, we believe that you are going to be a good candidate for a heart transplant, and so right now we're going to put you on a list. And it's not, you're not given a set time. You know, I've heard stories where people were saying like they were on the transplant list for years and years and years, and my heart goes out to them. Even when I had been hospitalized, there were patients in there that was probably in there for months and months just waiting for a heart to become available for them. And so it was just sad. You know, I didn't take anything for granted. I was glad that I was able to go home. And I just felt sorry for those people who were still in there, still waiting for a transplant. Um, and so back to what I was saying. Those are the factors that come into play for you to become a transplant candidate. So, as I was saying, your nurse practitioner, you get a whole staff of people who prepares you for when they call and say, I have a heart for you. I need you to get to, first, I have a heart for you. Do you want it? And that's the question, like, do you want the heart? And they don't give you a lot of information about the donor. They tell you some things, like the risk factors that was associated, like if they was a drug user, or if they did, if they was an alcoholic. They give you some type of description, but they don't give you everything about the donor. Everything is not disclosed to you. So you have to decide if you want to take this heart with some risk that may be associated with that heart. And so for me, I decided to say yes when they called me in March. And I remember just getting back from a little road trip, me and my significant other, my husband at the time. And we came back from Atlantic City. And the very next day, I received a call from the nurse practitioner, Nicole. And she said, "We have a heart for you. Um, do you want it?" And she went into a little bit of details, and I said, "Yes, I'll take it." I was just overjoyed. And she said, "Well, I need you to get up to Philadelphia, Pennsylvania. That's where I was implanted at with my heart. Hospital University of Penn. That's where I got my heart transplant at." And so I called up my significant other, and I'm like, "Okay, we need to get up to Philly like right away, like today." So packed everything that I needed, went up to Philly. I didn't get the heart right away. They were actually waiting for the person to pass on. So I think I got up there March the 27th or something like that. I can't remember. But I know April the 2nd was the day I had my surgery. I got my new heart. And I don't remember nothing. I was definitely scared because your heart is a vital organ. Without your heart, it's like you're done. So I was a little nervous. Like, I wanted everything. I just wanted to wake up and know that I had a transplanted heart inside of me. And another thing that was talked about as well is that if the heart was going to even take, like, if my body was even going to even take the heart, and even after they the heart transplant in, or the new heart, my body was still rejecting it. And I was in the ICU. I had a ventilator, breathing tube down my throat, and it was scary because they was like, "Your body is rejecting the heart." And I'm kind of like, "Okay, is this normal? Can you guys treat it? Blase, blase." So yeah, thank God that finally I stopped having the rejection. My body stopped fighting it. My levels for the immunosuppression drugs built up. I will say one thing that I did not like, because I had a breathing tube down my throat for longer than it was supposed to be in there. And so my left vocal cord actually had got damaged. So that was something else that I had to deal with. I overcame it. My voice eventually came back maybe 3 weeks later, 4 weeks, a month later. And also, I was in the hospital for over a month. But I received a lot of love and support from my family. Also, I will say, before you can go home, you have to have family members who is going to bring you to your doctor's appointments, who's going to make sure you take your medications, just help you out overall. Be that support that you need during your recovery. And so it's mandatory for at least the main people who's going to be helping out. They have to come to the hospital, sit in with the nurse. They have to go over all the medications that you would be taking, and signs to look out for, Like if something goes wrong or something like that. And so that's mandatory. What else? Yeah, that was pretty much it. And mm, no, I was just ready to leave and remind you at this time, my son is only he's only 1 years old. Um, so he's still young, and I was missing my baby. So this was really difficult. I was really tested mentally, you know. I was happy at the same time, but yet again, I was sad because I was not able to be with my son. And I was also afraid, like, what if he don't remember my voice? And, it was just a lot of things that was going through my mind. So, that's why they want you to have that family support where you're able to talk to someone if you're feeling a certain type of way, that you don't have to keep it bottled up inside and then you become depressed and it affects your heart because the stress being placed on your new organ. So, and then also, you start to look a little bit different. They put you on this high dosage of steroids, so your face is going to swell up. Like, for example, my face is still puffy and swollen because recently I had a hospital stay because I had a rejection with my heart. And so in order to treat that, they had to give me high dosage of steroids. So I'm going to go into that a little bit later about what actually happened. And what else? Oh, definitely you got to make sure you have to change your diet. Um, and so that could be a big issue for some people because some people are used to just eating whatever they want to eat. They always go back to the fact, like, I was perfectly healthy. This was my mindset. Like, I was perfectly healthy. I could eat anything I want. Now I have to be on a diet, a cardiac diet. It's no flavor. It's like, and then also I wanted to say, with steroids, in my case, I had to take prednisone, and I still take it. It helps with the prevention of rejection of the heart. And I became a diabetic. It was a drug-induced diabetes. So I am a diabetic because I take this particular steroid that causes your sugar to rise. So that was another factor that came into play. Like, you just don't get a heart transplant. I'm a diabetic as well. After the surgery, my kidneys were damaged as well. So I have moderate chronic kidney disease. It is not severe, but my kidneys were damaged because of all of the medications that was going through my IV. My kidneys wasn't getting filtered out. Also, the tacrolimus that I have to take for rejection, for prevention of rejection, also affects your kidney function. So, when people are deciding whether to get a heart transplant, well, some people don't have the choice. Okay. But if you have the choice to decide whether you want to get a heart transplant or you want to continue on using an LVAD, or you just want to just take heart medication that could probably stabilize the heart, and you don't have to get surgery. Um, you have to think about all the factors that come along with getting a heart transplant. You know, sometimes it's easier to just say, well, I'm just going to stick with the LVAD. I don't want to go on roller coasters. I don't want to go to the beach and get in the water. I just want to live just a simple life. You you know, so but I didn't. I wanted to live a great life. I wanted to live my life to the fullest. And so these are the factors that came with getting a heart transplant. And just knowing, like, okay, your body can still reject your heart. Like, you can still have a rejection. I've had over, I think, 5 or 6. I think I had like five rejections since my transplant in 2016. They haven't been severe. I know the last one was really severe. Um, and so that's scary, the fact that your body keep rejecting a heart that you need to stay alive. And but the only thing I can say is that I'm blessed. I'm glad to be here. God has covered me. He has guided the hands of these surgeons and doctors to make sure that they did the best job that they could do. God has kept me here, and I have no complaints. For me, if I have to deal with being a diabetic and having to be monitored for my moderate chronic kidney disease, I'm willing to do that. I mean, the pros outweigh the cons for me. I can't speak for everybody else, and that's why I'm here to just give like information to people who may be thinking about if they want to have a bridge to get a heart transplant. Or give them cons, like, okay, maybe it's not for me. I'm not good with making sure I take medications on time. I'm not good with, making sure that I check my blood sugar level. You gotta basically prick yourself and give yourself shots of insulin. So it's a lot. And some people may not want to do all that. But I'm here to give my testimony and give whoever is willing to listen the information and to tell you what comes along with getting a heart transplant. And then also, I had to do physical therapy after my heart transplant surgery. Just being in a bed, not being able to walk. A lot of fluid builds up in your body. Your body just went through a major surgery, so you're gonna have a lot of swelling on the inside and stuff like that. And I had a lot of fluid on me, and my legs was weak, my muscles, so I had to build my endurance back up. I had to go to cardiac rehab. So it's definitely a process, and you gotta have the mentality of saying, I'm dedicated. You gotta have the mentality of saying, I want to live. And you gotta have the mentality of, I have no other choice but to do this. I can't turn back. I already made the decision. They picked me. God blessed me with this heart, so I'm gonna make sure I take care of it. And also, the number one thing that I did it for was my son. My son was not going to be without a mother. So it was a no-brainer for me. So I thank you all for watching this video. If you have any questions, comments, click to subscribe, like, share. I will answer any questions you have. That's what I'm here for. This is why I'm doing this whole YouTube channel, is to give people my experience, talk about my testimony, and it's also therapeutic to help others. I'm a very passionate, caring person. If anything somebody need help with, anything, I was always that person and still am that person to want to help. And so I hope you guys join the movement of bringing more attention to postpartum cardiomyopathy awareness. And I want to get this thing going. I want to make it bigger than what it's not really that big now, but I want to make it big, and just sky's the limit. 2021 is my year, it's your year, and it's time for us to get healthy, and it's time for us to make our voices known on any type of matters that you can bring a change to. So I thank you all. God bless.